My husband had a problem with erectile dysfunction, and we were trying to find solutions. And of course, we first did the route of Viagra, and I don't know if there was any other medications because this is back in 1996. And we decided at that point to look for different options because it just wasn't working. And it was very important for us to have that sexual intimacy, and we did not have that, and we could not have that. And it was a tremendous void. So we checked out New York Hospital, which I think is the greatest hospital around, and we tried to find the best man in the department that we thought had the most experience, and that was Dr. Eid. And we had our consultation, and he was very informative, and he gave us this option. And I just forgot to say that we also tried injections, which were totally a nightmare, which is one of the course of treatments that they do recommend is to try that with a urologist who is local on Long Island, and it just was to no avail. They really were horrible. There was no spontaneity. I mean, it was really injections in the penis, and it was bleeding, and it was really bad. So we weren't going to do that. So that's when we came to Dr. Eid and looked for another situation or circumstance that might help us. And sure enough, he recommended the implant. And at first, of course, it's foreign, and you don't really know if it's going to be something that's going to be good for you to do. But we really wanted to have it back. We were young enough to really want to enjoy each other and have each other. We loved each other so much, and we really wanted that intimacy back. So we went ahead with the procedure, and it was a very minimal procedure. It was an outpatient, and his recovery time was short. And within a few short weeks, he was able to use the device, and it worked beautifully. And I think we used it from 1996 until 2003 without a hitch. It was never a problem, never an issue. And we really, really, really didn't. It was very natural. It didn't feel like there was anything that was not natural. It was just really, really wonderful experience for us. And ironically, I have another relationship now, and we went through the same scenario with the pills, and nothing worked. And I wasn't about to try the injections at that point because I just knew that they were just not really good. So we came back to Dr. Eid, and he informed us that the implant was still the course of treatment and that we should use it the same way, but that it was much improved and that there would be much more benefits to having this kind of an implant as opposed to the older one. It's a great thing. I mean, it's really a wonderful thing for women who really want to have their husbands and their closeness and all that. It's so important, you know, and we really are looking forward to being able to have success just as we did the last time. Well, you know, like I said, being educated in what surgery is, you know, there's always a risk with any anesthesia. We had a spinal today, and I think it was minimal amount of anesthesia, and he came through with flying colors, and there's always a risk in any kind of surgery, but, you know, people opt to take that risk. It's a very small risk, and, you know, as long as he's healthy, and Dr. Eid was very, 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 very conscientious about everything being normal and checked out, and prior to, we had all kinds of testing. I think we came 3 or 4 times for different procedures to check his bladder and his urology situation and making sure that he was a good candidate, you know, being astute and doing all the things you need to do to have a successful surgery. I think we did all of that, and Dr. Eid was terrific. Well, you know, obviously there's it's a few short seconds, and really you really don't have to be involved in it. Usually my husband would just do it himself, and then in a few minutes, once you're just getting intimate and close, it's just there, and you just feel like it's a natural thing because you're not standing in a bathroom and taking a needle out and injecting yourself, and it's just, you know, it's a very private moment, and, you know, I really never did anything to initiate the implant. I just waited for him to have that done, and then he just came to me, and we were just totally able to be intimate, and it just felt like it was a natural erection.